You've probably heard of acupuncture. Tiny needles, ancient Chinese medicine, promises of pain relief and healing. But can acupuncture actually help you? Is it science or just placebo? In this video, we'll explore what acupuncture is, how it works, what modern research says about its effectiveness, and whether it might help with your specific health concerns. By the end, you'll have a better idea of whether this ancient therapy is worth a try, or just another wellness trend. Let's begin. Acupuncture is a practice that originated over 2,000 years ago in China. It involves inserting very thin needles into specific points on the body to promote healing and restore balance. Traditional Chinese medicine teaches that energy, called qi, flows through pathways in the body called meridians. When that energy is blocked or imbalanced, health problems occur. Acupuncture is believed to help restore the natural flow of qi. But what does that mean in modern medical terms? Today, many researchers believe acupuncture stimulates the nervous system. When needles are inserted, they can trigger the release of endorphins, improve blood flow, and influence brain chemistry. The needles also stimulate tiny nerves in the skin and muscles, which may reduce pain signals sent to the brain. So, does it work? Let's talk about the evidence. One of the most researched uses for acupuncture is chronic pain. Several large-scale studies have shown that acupuncture can reduce pain levels in conditions like osteoarthritis, back pain, neck pain, and migraines. In fact, a major review published in the Archives of Internal Medicine found that acupuncture worked better than no treatment or standard care for these types of pain. Another study, published in the Journal of the American Medical Association, looked at over 20,000 people and concluded that acupuncture was significantly more effective than sham treatment. Sham treatment, by the way, is a fake version of acupuncture where needles are placed randomly or not inserted at all. That means there's something real going on, not just placebo. Still, acupuncture doesn't work for everyone, and it's not a... So let's break down some of the most common conditions people try acupuncture for, and what the science actually says. First, chronic pain. As mentioned earlier, acupuncture has some of its strongest evidence here. For people with long-term back pain, arthritis, or tension headaches, regular acupuncture sessions may reduce discomfort and improve quality of life. The American College of Physicians actually recommends acupuncture as a first-line treatment for chronic low back pain, before drugs or surgery. Second, migraines and headaches. Multiple studies have found that acupuncture can reduce the frequency and intensity of migraines. It may also work for tension headaches. Some researchers believe it helps by releasing endorphins and relaxing the nervous system, while others point to its effect on blood circulation in the brain. Third, anxiety and depression. The evidence here is mixed, but promising. Some studies suggest acupuncture may help relieve symptoms of anxiety and depression, particularly when used alongside conventional treatments. It's thought to stimulate the production of serotonin and other mood-regulating chemicals. That said, it should not replace therapy or medication for serious mental health conditions, but it might be a helpful supplement. Fourth, insomnia. If you have trouble sleeping, acupuncture might help. Several studies, including one in the journal Sleep Medicine, found that acupuncture improved sleep quality and reduced symptoms of insomnia, especially in people with chronic stress or anxiety. Fifth, fertility and menstrual issues. This is a growing area of interest. Some fertility clinics now offer acupuncture alongside IVF treatments, with the hope that it improves blood flow to reproductive organs and reduces stress. While evidence is still emerging, a few studies suggest that acupuncture may improve pregnancy rates when combined with medical fertility treatments. For menstrual pain, Acupuncture has shown promise in reducing cramps and discomfort during monthly cycles. 6th, digestive disorders. People with irritable bowel syndrome, bloating, or chronic indigestion have turned to acupuncture for relief. Some research suggests it may help regulate gut motility and reduce inflammation in the digestive tract. It's also thought to have a calming effect on the nervous system, which plays a key role in digestion. 7th, cancer support. Acupuncture is sometimes used as a complementary therapy for people undergoing cancer treatment. While it's not a cure for cancer, it may help manage side effects like nausea, fatigue, and pain. In fact, the National Cancer Institute acknowledges acupuncture as a potential tool for improving quality of life during treatment. 8. Allergies and asthma. Some studies have shown acupuncture may reduce symptoms of allergic rhinitis, like sneezing, congestion, and itchy eyes. For asthma, the results are less consistent, but a few small trials suggest acupuncture might help reduce inflammation and improve lung function when used in combination with standard treatment. Now, let's look at some myths and realities. Myth: acupuncture hurts. Reality: most people report little or no pain. The needles are incredibly thin, about the width of a human hair. Some people feel a small pinch or tingling sensation, but it's usually brief. Myth: it's only for people who believe in it. Reality: while mindset can influence outcomes in any treatment, many studies have shown that acupuncture works better than placebo in people who are skeptical. Myth: you need to believe in Chinese medicine to benefit. Reality: acupuncture is now used in hospitals and medical clinics around the world, including those that focus on science-based care. It's even covered by some insurance plans in the US. Now, let's talk safety. Acupuncture is generally considered safe, especially when performed by a licensed and trained professional. The needles are sterile, and side effects are rare but can include minor bruising, slight bleeding, or temporary soreness at the insertion site. In very rare cases, people have experienced dizziness or fainting, often due to anxiety or low blood sugar. Serious complications are extremely rare when the procedure is done correctly. So how do you know if a practitioner is qualified? Look for someone who is certified by the National Certification Commission for Acupuncture and Oriental Medicine, NCC, AOM, or licensed in your state. Ask about their training, experience, and whether they've worked with people who have your specific condition. Now, you might be wondering, how many sessions do I need? That depends on what you're treating. For chronic pain, some people notice improvement after just a few sessions, while others may need ongoing treatments. A typical course might involve 1 or 2 sessions per week for 6 to 8 weeks. Your practitioner can give you a personalized plan based on your needs. What does a session feel like? You'll lie down on a treatment table, and the practitioner will gently insert needles into specific points on your body. Most sessions last 30 to 60 minutes. You may feel deeply relaxed, even sleepy. Some people report a slight heaviness or tingling in the body. That's normal and often considered a sign the treatment is working. It's important to stay hydrated and rest after your session. Some people feel immediate relief. Others may feel a little tired or sore, then notice improvement over the next 24 to 48 hours. So, can acupuncture help you? Here's a summary. Acupuncture shows solid evidence for helping with chronic pain, headaches, and certain types of stress or insomnia. It may also support fertility treatments, reduce menstrual pain, improve digestion, and ease side effects from chemotherapy. While it's not a miracle cure, and not everything has been proven yet, many people find relief when other treatments haven't worked. If you're dealing with chronic pain, stress, digestive issues, or sleep problems, and you're looking for a low-risk, drug-free option, acupuncture may be worth a try. But remember, acupuncture should not replace emergency medical care, mental health therapy, or essential medications. It works best as part of a broader wellness plan. Before you begin, talk to your doctor, especially if you have a medical condition, are pregnant, or are taking blood thinners. And always choose a licensed practitioner with good reviews and proper certification. In the end, acupuncture may not work for everyone, but for many people, it provides a sense of balance, relief, and calm. Whether you believe in Qi or not, your nervous system responds to touch, pressure, and care. And that may be the real magic behind those tiny needles. Thanks for watching. If you found this helpful, hit the like button. Subscribe for more science-based health videos, and let us know in the comments if you've tried acupuncture and whether it helped you. Stay curious, stay informed, and be well.